Hi, my name is Tian. You're welcome. We are going to be talking about nutritional assessment. Nutritional assessment is a comprehensive evaluation used to determine an individual's nutritional status and identify those at risk of malnutrition. This process is crucial for diversing appropriate nutritional intervention and supporting overall health. It involves a variety of measures, which include anthropometric data, that is, body weight, height, and BMI, biochemical tests, that includes blood tests, nutrient levels, liver and kidney functions, and clinical examination to observe physical signs of nutrient deficiency. And the last one is dietary evaluation, often conducted through 24 hours records, food frequency questionnaires, or food diaries, which provide insights into usual intake and dietary habits. These anthropometrics, we can just sum it up to ABC. A, which stands for anthropometric, and then B stands for biochemical, and C, which stands for clinical, and D, which is dietary assessment. We are going to start with anthropometrics. Anthropometric is an essential tool in nutritional assessment, providing valuable data on individuals' body composition, as we earlier mentioned, through the measurements of physical parameters. These techniques they all involve measuring the body weight, height, body mass index, as we mentioned above. It also includes waist circumference and skin fold thickness, and even mid upper arm circumference. We are going to take you through this measurement, and I will drill you step by step on how to carry out all these measurements. We'll start by body weight and height. Accurate measurement of height and weight is crucial for assessing nutritional status and monitoring growth and development in children, not only in children but also in adults. Following standardized guidelines such as those provided by the UNICEF. Yes, all of these is given by UNICEF. Ensures consistency and accuracy in the measurement. Here is a breakdown of how to properly measure height and weight according to UNICEF. Measuring height and length for infants and children under 2. I did not say above 2, under 2. These require 2 adults because it's quite difficult to take measurements of children. So this is the reason why we require 2 adults to carry out this measurement. One person is responsible for holding the child and the other is responsible for reading the measurement. So 1. The length. The children under 2 years should be measured lying down, meaning there is a board with 2HN where the child's leg can they can stand perpendicular to the board, and another one from the head where the other person try to adjust the baby's head, making sure that there is no movement, and the person down is also adjusting the baby's leg to make sure that there is absolutely no movement so that they can take a correct measurement. And then the equipment used is a length mat or a fixed board, like I'm trying to explain. And then for this procedure for taking length and weight for a kid is 1. That is, the child should be laid on their back, like flat on their back. Secondly, legs should be straight and with the knees pressed down. That means if you do not hold the knees, you're not going to take the correct measurement. Any measurement you take isn't appropriate to the child's height. And then feet should be perpendicular to the leg board, like I said before. And then a second person assists by gentle holding the child's knee, meaning anything you're doing with the child, it has to be gentle. You don't have to force the child down because you might end up hurting the child. So you have to make sure that the child is also not throwing tantrums before you are taking this measurement. If not, it's going to be difficult for you. And if you're forcing the child on the board, rest assured that you won't get the right result. Then the last one is the headpiece is brought to the top of the child. That is from the head, like I explained. The butt is having boards, two extra boards that they can be moved according to the length of every child. So when they are moved like that, from there, the person from the knees, the person responsible for the knee section, can then read whatsoever figure is on the board. We will now move to children above 2 and adult. For children above 2, they have standing height. Yes, we all do that in most hospitals. And to inform you, some hospitals are already advanced in such a way that they have different types of meters. That is, they no longer use stick, which is a traditional method that was formerly used to take people's measurement. Some hospitals now use a statiometer to take all this measurement. So for the procedure, we will move by 1. We stand straight with heels, buttocks and back of the head against the measuring rod. But before you do all of this, you have to make sure that you have no some how do I explain this? You don't hold a lot of things on you, so that even though it's not the weight, but you make sure that you're not holding anything that can obstruct this measurement. So you make sure that you are carefree and we can take the measurement properly. And then the second aspect, the second step will be legs straight, feet flat, and heels touching the backboard. That is the backboard of the statiometer. And then the third, which is you look straight ahead with the line of a side parallel to the floor, so that your head is approximated to the meter, to the statiometer. Yes, so you look forward. And then the last one is lower the headboard until it rests firmly on the top of the head. That is, the headboard, you bring it down so that it touches your hair. For such hair, like hairstyles like mine, we are going to make sure that we estimate the number of maybe the space that is left, and we subtract it so that we are able to get the correct length. So another type of measurement what we're going to talk about is measuring weight for all ages, not just for kids, but for both kids and adult. Equipment used for this weight measurement is a calibrated digital or a beam scale. Some hospitals already have that, but I'm sure we see all of these things in the hospital. Whenever you go to the hospital for a checkup or you do it, the first procedure or your first checkup is always an anthropometric measurement. At first, when I didn't know this, I always thought, well, these are usual measurements. These are just the usual things that we're taking. But I didn't know that from all these measurements, as you enter the hospital, they can actually detect if you are malnourished just from taking your height, your weight. And so these measurements are called anthropometric measurements. For measuring weight, procedures include the scale should be on a flat and hard surface. Shouldn't be on something slopey, because that will alter the readings. And then secondly, the person should remove shoes and heavy clothing, not just heavy clothing, jewelries, bangles, and handbags. Anything that will alter the weight, we have to remove it. Or the person whose weight is being taken and is in position of all these things, we'll have to remove all these things so that we can have the correct measurement. And then the third procedure is to stand in the center of the scale, evenly distributing the weight, meaning you do not stand maybe too much on the left or too much on the right. You stand evenly in the center. of the method, the calibrate. And then fourth, we're going to record the weight to the nearest 0.1 kg, to the nearest 0.1 kg for adult and 0.10 kg for infant. For body mass index, which is BMI, is a widely used measure to classify individuals based on body size. Yes, it is a simple index calculated from a person's weight, like from what we just talked about, the procedure. Here we calculate it from the person's weight and height. We spoke on how to take this height. So after taking the height and the weight, what do you do with it? That is where the body mass index comes in. So we are saying that a simple index calculated from a person's weight and height and is used to categorize whether the person falls under underweight, overweight, obesity, and normal. Yes, if you're normal or you're underweight, overweight, or obese, that is this. Most of these classification are for adult. And then, despite its widespread use of this BMI, it has a limitation, which is because this limitation is because it does not, yes, the BMI does not account for the muscle mass, overall body composition, or the distribution of body fat in the body. While we are going down, we will talk on the other. And then for calculating this BMI is calculated using this formula, which I'm going to show you from my phone. This formula, as you can see, is the World Health Organization that has classified it this way, a method which is accepted and is used to calculate the BMI. From this BMI, we can determine the underweight, and for underweight, BMI is less than 18.5, and for normal weight, BMI is 18.5 to 24.9, and for overweight, BMI is 25 to 29.9, and obesity, BMI is 30 and above. So if you are able to use this formula and you calculate your BMI, you calculate your height and your weight, and you get a response within this range, you should be able to know where you belong. So it's not even as if the doctor or your nutritionist has to help you calculate this. You can calculate this yourself. So I will also drop this formula again so that on the comment section, so that you can use it anytime and watch how you control your feeding, watch how you go around with your weight and your size, so that you don't get to any range that is abnormal or will cause you problems in the future or even presently. So you can do this without necessarily going to a dietitian or a nutritionist who help you know your body mass, so you can quickly run this through. All of this can be done by you, but if you need an expert to drill you along or can help you take all this measurement, because as we are going forward, we're going to be talking more on some things that you cannot carry out. You cannot do it on your own. Yes, you will need an assistant, but if you think you can do it on your own, good and fine. You feel you can do it and the result will be correct, so be it. So another limitation of BMI is that BMI does not account for the distribution of body fat, such as the visceral fat, which is a significant risk factor for metabolic syndrome. Yes, so it doesn't. Please make sure that you know your BMI. Whenever you go to the gym, don't just go to the gym without knowing your BMI. Yes, you can go to keep fit, to keep shape, but it's good that you know your BMI and know where you belong, so that you can start watching your weight, watching your size, the kind of exercise that you need to balance up, or maybe the kind of fit you need to meet up the nutritional need of your body. So These components are very important. They are all important. So we'll be moving on to the next aspect, which is the waist circumference. Waist circumference here is going to tell us the amount of fat that is situated or deposited around our stomach. I hear some people say they do not owe anybody six packs. Yes, you do not owe anyone six packs, but rest assured that the fat around your stomach that you claim to be one pack, which is good or healthy for you, can be risky for you in the future. Yes, it can be your body fat already accumulating or depositing there, and it's not being metabolized or used, and in the future you're going to suffer the consequences of it. And these consequences include hypertension, obesity, diabetes. Imagine your insulin no longer working again, meaning you're going to live the rest of your life on insulin dependent. But that's not the kind of life you need. So the earlier you know all of this right now, the better for you in the future. So we're going to talk about the waist circumference and how you can take this measurement. Oftentimes you do this without knowing that you're actually carrying out the waist circumference. Yes, I will quote an example at the fashion designers store. Yes, when you're taking measurement for your dress, sometimes they'll be like, oh, put your hands up, and they'll take a tape around your waist. Your waist is 25, your waist is 35, your waist is this. That is an anthropometric measurement, but we do not know that that is part of an anthropometric measurement. From there, you can just take or seize the opportunity and you know your waist circumference. When you know your waist circumference from there, you will know if you are healthy, you need help, you need to cut down, or you need to step up. So whenever your designer is measuring your waist, take note of your waist. Yes, take note. So what is this waist circumference? First of all, waist circumference is an anthropometric measurement that qualifies the amount of abdominal fat present around an individual's midsection. Yes, this measurement is an important indicator of health because it specifically assesses central obesity. Yes, I already said it. Fat deposition around the abdomen, which is a critical factor in various health outcomes. So, the importance of measuring this waist circumference, I already told you, but I will keep reminding you again. If I have to do it every day, I will do it. This provides a general indication of weight relative to height, and waist circumference is directly related to the risk of developing obesity. Related health conditions obesity related health conditions. Central obesity is particularly concerning because it is strongly associated with an increased likelihood of developing metabolic syndrome. This metabolic syndrome, once you have them, they are hardly treated, or they are not even treated at all. All you do is find a way on how to measure the maintain or care or see that you don't surpass a risk. If you surpass that risk, that's all about you. You go 6 feet. So these metabolic conditions include increased blood pressure, yes, high BP, increased blood pressure, high blood sugar, excessive body fat around the waist, yes, which is obesity, and abnormal cholesterol level. Yeah, you also have to know that we have the bad and the good cholesterol. Though cholesterol is not all that bad, but that will be a topic for another day. Talk about the good cholesterol and the bad cholesterol. So when the bad cholesterol deposits around your waist, it is not a good sign. How to measure waist circumference? We'll position the tape. That is, when you position the tape, place the tape, measure around the abdomen. Excuse me. Measure the waist, measure around the abdomen at the level of the iliac crest, just above the upper hip bone. Ensure the tape is parallel to the floor. Yes. Patient position too, or the individual that you're taking the measurement, the person being measured should stand upright, feet together with arms at the side and body relaxed. You're not supposed to be tense or stiff. The measurement should be taken at the end of a normal exhalation. Yes, you have to exhale. That is to make sure that you are relaxed and you exhale to ensure natural results, so that the results are not falsified. Then after doing that, you read the measurement. Is that not the same thing we do at the tailor's place, the seamstress place? Those are the kind of things we do there. Now, how do we interpret these results? For non-Asian population, men, yes, for the men, you will have to know that a waist circumference greater than 102, which is 102 centimeter, which is 40 inches, is considered high risk. Yes, and tell me, I'm a sugar daddy. Yes, I'm really reaching a sugar daddy's age. So his stomach like that is meant for sugar daddy. It doesn't need anything, my dear. Yes, my love. In fact, my dear sugar daddy, you're getting yourself at risk. Your sugar now, in the future, you suffer alone, and when you die alone. So you better take care of your health. No one is coming to do that for you. And then for women, a waist circumference greater than 88 centimeter, which is 35 inches, is considered a high risk. Yes. The tum big belly. The tum big belly you say you're proud of, my love, please make sure you look into it. If it's a healthy tum big belly, if this one is natural, your gene, yes, genetics, make sure that it is not that late night fufu or the late night pizza or processed food that you consume that are causing this tum big belly that you have. Yes, soon you come and be telling us you are proud of the big stomach, but apparently you can be getting into a risk that will take you even your lifetime, like a lifetime, to solve this problem if you're not careful. So for the Asian population, we know that these people, they frequently drink tea, they eat noodles, they don't even eat things that contains fat. So for them, it's not really a problem. So to get somebody who is fat in Asia is really something, it's difficult. So for the men who are from there, you can get a waist circumference greater than the 90. Here we have 102. Why are they even putting us 102? And then in the Asia, they are putting them 90. These are people that do not venture into fatty food. Anything with too much fat, they are not there. And even if they eat, they have the tendency of practicing bulimia. Eat and they go and throw out. Yes, they either eat and throw out. We often see them on Facebook where they come eat a huge quantity of food, and you wonder where this food is going to, my dear. After eating, they throw out. Yes, they force the food out of their stomach, or if the food cannot come out, they use laxative, but oftentimes they remove it through their mouth. So that is what is happening, and that is why they remain that thin. And at the same time, they come and they show you that they can eat this quantity of food, and you might fall for it. You try it without even removing the food out, my dear. You are putting yourself at your own risk. And then the women, for the men, they have 90. Why for the men who are non-Asians, they have 102. And then for the women, they have 80 centimeter. And then why here we have the non-Asians, they have 88. So you see the difference. They know the risk of having too much fat in the body. Reason why they always watch out the kind of fatty food that they take in. If you're taking the fatty food in front of you, my dear, it won't stay for long. Yes, it won't stay for long. They won't have anything to do with it in their stomach. They will allow it to digest. Yes, they will not allow it to undergo digestion. And for health implications of this health waist circumference, like I said, in the future you can acquire cardiovascular diseases. Yes, you can acquire cardiovascular diseases, arteriosclerosis. Yes, meaning your fat has gone and it has blocked your artery. Blood can no longer pass freely and circulate freely in your body, and blood cannot move freely to your heart, in and out of the heart. And you know very well that without blood circulation, that is where you get to hypertension. Yes, you get to hypertension and cardiovascular problems. Yes, and then type 2 diabetes too. Excessive abdominal fat is linked to insulin resistance. Yes, when the insulin is tired of always metabolizing the excess fat that you bring into the body, this is where it will lead you to. So save your insulin, the stress. You must not eat all this process, all those fatty food. I don't know if you're craving. There is a moderate quantity that you can consume, not that you consume all of it every time. Even metabolic syndromes. Yes, metabolic syndrome. And at the end of the day, all of this can lead to mortality. Yes, if you don't know. If you don't take care of your health and you think, oh, having one pack, it's okay. Sometimes people just sit and they just die. You wonder, what happened? Oh, like village people, they have done it. Oh, they have done their own. This time around, this man that he can't even talk. This woman that could not even do anything. But you don't even know that these are some kind of things that we do without knowing. Sometimes you eat, and these things, they accumulate gradually until they reach toxicity without you knowing. And so at one moment you just give up, and they will say that it's just yesterday, oh, he cried headache, and now he's no more. Hey, he's involved, oh, he is this. People are moving on the way. You might look at somebody who is on a wheelchair and you feel like, I'm better than him. My love, you can be worse. Yes, you can be worse, because every day we eat a lot of contaminated food out there, especially with street food. Yes, especially with street food. Food like let me just quote example. Pop and beans. Yes. When you buy pop and beans, mommy pop will cut pop. She wash her hand, oh, cut pop and put in the pot, and it's fried. The same hand that she wash her hand there, she still gonna wash again. Then come now wipe it on her loin or her waist. Then collect money from you. Money that has been moving from one place to another, gathering all kinds of gems and Mary. And she will just take it with that hand. Or maybe she wants to give you change. You just see how she's touching the money. She doesn't even wear gloves. They are plastic gloves. Yet they do not wear them. They do not wear them before they manipulate that money. Sometimes they didn't even wear them to remove the pop from the basket to give you. And at the end of the day, that's how you keep accumulating. You eat. It's just small. Yes, today it was just small. And tomorrow you will eat the plantain. Plantain that maybe, roasted plantain that maybe the wrong wood was being used to roast it, and now it has accumulated. The smoke has entered the meat. Oh, it tastes so great. And now this smoke is not a good one that your body can sustain it, and you eat, and it goes and accumulate again. You move again to soya that they don't even clean the grillage. Yes, they don't clean. How many people making soya do you see that they clean their grillage? So that's to tell you that if you don't take care of your health, or you see someone on the way, you feel like you're healthier than this person, I can guarantee you that if you go to the hospital, that same person can be better than you, but you won't even know about it. So take care of your health, take care of what you eat on the street. Know that these people are in for business. They don't care about you, especially those selling soya. Some of them don't wash their grillage for years. Even to just those roasting fish, they don't wash it. Yes, they don't. Excuse me, they don't watch it. But yet we consume food from there. Our next measurement we're going to be talking about is skin fold. Skin fold measurements are taken with a device known as a calipers. 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 These calipers are designed to apply standard pressure to the skin and underlying fat, ensuring that the fat is measured while the underlying muscles and tissues are not compressed. Yes, so when you are taking the skin fold measurement, you don't have to apply much pressure just to make sure that you get the skin fold. Skin fold, like I'm doing, is like this. Yes, That's the skin fold. You don't have to, like, try to bring it out. I'm just doing it with my hand, but with the appliance, you do not have to apply much pressure, because it will definitely hurt the person. And it's worse because you have to carry out this exercise 3 times just to make sure that you're doing it correctly and you're getting the right measurement. So when you do once, you do it again, you do it again. If you're doing for the first time, you have maybe you have a certain figure, and then you're doing for the second time, you have a different figure. You're doing for the third, you still have it. No, you're not doing it correctly. You have to make sure that for the 3 times that you're doing, you have the same result. Or you did it 3 times and you achieve good results 2 times at least, if you want to make a mistake. But for an expert, you must do it thrice, and you have to make sure that you get those results. If not, you won't be able to tell what is actually going on with your patient or your client. So where we can take these skin folds, we have the triceps, you have the biceps, scapulars, and then we also have suprailiac. Suprailiac now, that's just above the hip bone. That's where you can find the suprailiac. And then for the thigh, that's the front of the thigh. Yes, you take the measurement from there. So you have to put the device there. You put the device there, and you read. You release the flesh, or let me say the meat you got. You have to do it 3 times, please. 3 times, because sometimes this appliance, or sorry, this equipment doesn't give the correct measurement when you don't do it well. Yes, if you're not an expert, you cannot know how to do it. So as time goes by, we'll also make more videos on why showing you how to carry out all this measurement. Today is just theory. Yes, today is mostly for theory, and next time will be practical. I bet you enjoy our practical. All right, so for calculating body fat percentage, once the skin fold measurement are taken, the sum of these measurements can be entered into various equations to estimate body density and subsequently calculating body fat percentage. Yes, so the derived body density is then converted into a body fat percentage using the serial equation. The serial equation, which is body fat percent, which is equals to, in bracket, you open bracket, that is 495 slash body density, in bracket again, minus 450 times 100. That is, the skin fold is the body density that you will use. Yes, so you will divide it. You will divide 495 and divided by the body density, which is the skin fold that you took, and then you minus it from 450 and times it by 100 to get the percentage. This formula is to get the percentage. I'm going to write it down so that you know how to get to it and how to use it. Okay, so some advantages of this skin fold is that it is cost effective. Yes, it doesn't demand a lot. Yes, it's cost effective, and so it's also practical. Like, it is relatively quick method that can be used to perform certain various settings, which include clinic, gyms, and at home with minimal training. So some limitations of this technique include technical sensitivity. That is, you might want to take the skin fold like this. See how I pull my skin, but I'm doing it because it's my skin. I do not feel the pressure, and so you might be doing it on another person. You do not know that it's hurt, and you keep mounting in pressure and expecting the person to talk. Sometimes some people who do not even know how to talk, they can just suck the pains, maybe because of what they've been through, things that are more painful than that, and so they can just suck it. So you have to make sure that whatever you're doing and the activity you're carrying out, you always find out from your patient if they are comfortable and If they complain, please make sure that you do not give them a judgmental look or yell at them. So that they don't feel comfortable, they don't feel uncomfortable around you. Make the exercise joyful for them and joyful for you as well, because these exercises, they look simple, but they need techniques and expertise to carry it out. And if you are doing that in a kind of environment that is not good, you're either grumpy, rest assured that there are some results that you take that do not correlate to the individual's results that you will actually get if you had a happy face. So just make sure that you always find out from your patient if you're holding the skin. It doesn't hurt. These are the kind of questions you have. If it hurts, you let me know so that I stopped. You get. So that is how you do it. And then population specific. The equation used to calculate the body fat and skin fold measurement are derived from specific population, and their accuracy may vary among different racial, ethnics, and age groups. Yes. Yeah. So now we're going to move on. We're going to move on to the head circumference. I don't know this. It sounds funny to me because it's just for kids, and when I was a kid, I used to have a very big head. But look at me right now, what I have. If they tell you that was me, you will definitely refuse. My head now is really small, and I hate it when you tell me that my head is small. Please don't come and tell me that my head is small. So I like this exercise so that I can see where I was before. When I'm doing it, or when I'm given the chance to do it with kids, it will be so interesting to do it. This was never done to me. I wished it was, so that I could maybe go back, look at the result and see what was wrong, or maybe that was just how I had to grow. So head circumference is just for kids. Yes. So for the head circumference, excuse me. The measurement of the head circumference involves using a non-stretchable measuring tape, typically made up of plastic or fiberglass. Fiberglass is, is not holding you so tight. Yes, when they put it around your head, it doesn't make the child to feel uncomfortable, which is placed around the largest part of the head. This is usually above the eyebrows. Yes, above the eyebrows. And yes, like this, and around the back of the head at the largest protrusion. So the procedure involves some steps. These steps include positioning, obviously, in all the measurements. Under anthropometric assessment, we have positioning. You must learn how to position your client or your patient. So we always start by positioning. If you do not position your patient well, I bet you will not get the right result. You will not. So if it's a healthy patient, you have to always position the patient. Those that are on bed rest or cannot move, they have a way of carrying out their own measurement. But for a healthy person, a healthy child that is not on the bed, is not sick, there is always this point one, which is positioning your client. And so the child should be calm. Like I said, always make sure that you're joyful. Make sure that things that concerns the kid, they are not throwing tantrums, even though you find it so difficult to get your result. And so make sure that the child is calm, seated or lying down. When the child is lying down now, you have to make sure that he or she is comfortable lying down. The measurement should ensure that the child's head is positioned normally, not some kind of way that might hurt the child's neck. Not that you position the child's neck like this, then you're like struggling to take the head circumference. That is not right. In some few seconds, the baby's head or the child will have to complain, will start talking, "Mama, my head is my neck is paining." So Another aspect is how to place the tape. The tape measure should be wrapped around the head, ensuring it is level and snug but not compressing. Like I said, if I touch my skin, I touch it to the level that doesn't hurt me. If I'm touching another person's skin, I have to make sure that it doesn't hurt the person. And so when you're doing or when you're snogging the knot or the tape, you have to ask the child, are you comfortable? Is your neck hurting you? Is something disturbing you? Yes, all those questions, so that they can give you the opportunities where they can say, oh, you're a fine doctor, you're a nice auntie. You do not yell at them when you want something, and they will be humble enough to give you your result. You'll be able to allow you to take the measurement that you want. And so after doing that, when you snug the tape, you read the measurement. Yes, the measurement should be taken at the point of the greatest circumference, which can be checked. Yes, it can be checked. So you do not come and you stand in front of the child, take the tape behind. So you cannot stand in front of the child, then you take the tape and you are struggling to read the measurement standing in front of the child. So it's always good that once you send the tape behind, you can hold it with one hand, see how you can go behind and read the tape there properly. Because if you're actually standing in front of the child and then you look behind to read, you might not read the right measurement, or the tape might lose a bit. And so that means that the measurement has already been altered. Or you stand directly behind the child and then you can put the tape there, make sure that it goes on around the ear, yes, above the ear, and then you can stand behind now. That is much easier rather than maybe standing and obscuring the child's view. Children, they always want to see, they are always curious, So they some important and significance of this head circumference, measuring its head circumference, and growth monitoring. Yes, this head circumference is to tell you that regular measurements of the head circumference help to monitor the growth of the brain and skull in infant. So, like I gave a brief story about myself, I want to believe that. I don't want to believe either. That maybe my brain was growing more than my age. I don't know. I don't actually know what to say, but but I just hope it's not what I'm thinking. So this monitoring is to see that the head of the child is growing as per the age or as how it should grow. And this will tell you if your baby is feeding, if the score is growing well, if they need assistance, they need to improve or they need to reduce. So it's very important. And then you also identify neurological problems. Neurological issues here, there is problems such as hydrocephalus. Yes, hydrocephalus, as a fluid accumulation in the brain, abnormal small head size or abnormally large head size. Hey, please, I don't want to know that I had abnormally large head size. And so the head circumference measurement are compared against standardized growth chart tailored to specific ages and sex. So like from the beginning, it is World Health Organization's thing that provide growth charts that are widely used internationally for the children from 0 to 5 years. This chart can help healthcare providers to determine if a child's head growth is within a normal range compared to the peers. And so at times the reason why I'm talking about my own head is because maybe I used to look my peer and I see that my own head was bigger, and so but look at me today, I'm looking at my peers and I'm like, what's going on? Why is it the reverse? But I'm here to explain the reason why it is like that. It's kind of funny, to me. Yes, it's kind of funny to me. And so below normal range, measurement significantly lower than the norm by indicating on the development of the brain and skull. Ew. And above the normal range, that is significantly higher may suggest conditions like hydrocephalus or other disorders leading to increase in intracranial pressure in the brain. Yes. So this head circumference is applicable in clinical setting, public health monitoring, and research. So this can help us with our research. If you are carrying out a research according to, or maybe concerning children, you will need this head circumference measurement for kids. Another measurement for kids is MUAC. MUAC, which is mid upper arm circumference. Mid upper arm is also for kids, and it is a tape that has been graduated. There you can have different colors. You can have yellow, you can have green, you can have red. Now, when it's on green, it shows that the child is normal. Meaning, this tape, you take and like I first of all said, we start by positioning, meaning you have to lift the child's arm up, take the tape round, or you put the child's hands down to relax. Yes, and then you put the tape around, you position it, you snug it. When you snug it now, you're going to see if where it's snug is on red, is on yellow, is on green. Now, green, red, you obviously know what red stands for. It's always danger. This mark tells us how malnourished the child can be. Yes, underweight or overweight. Yes, so that is for children. Children might not do skin fold, but what you do for them is mark. So the yellow shows that they are normal, and then green, the yellow or the green, depending on how your own tape is being graduated. So the yellow might stand for normal, or the green might stand for normal, and then the yellow and the green too, any of them can stand for abnormal. So all of this help you to determine if an individual is underweight, overweight, normal, or obese. So overall, the use of anthropometric in health and nutrition, it offers a comprehensive approach to understanding and improving individuals and population health, emphasizing its significance in promoting better health and outcomes through informed data to derive data-driven strategies. So this is the use of anthropometric measurement. We all can do this at home if we only know the importance of this anthropometric measurement. They might look like they are no importance, but they have a lot of information to send out. Through this, you can only know without going to the doctor if you're obese, you're underweight, you're normal, or you're overweight, and this can help save your life. Like I said, everybody moving on the street is not 100% healthy. Do not look at your neighbor and feel like they're better than you or you're better than them, or that healthy rich neighbor's child who eats a chicken every day and is so bulky, and you feel like your own child is not healthy for not eating that chicken. Your rich neighbor's child might be suffering from juvenile diabetes, or obesity, early stage obesity. Yes, and diabetes too can also come in, which is at the juvenile stage, type 1 diabetes. So make sure when you're having somebody, know that there are other internal factors that you cannot determine and cannot do anything about it. So our next assessment we're going to go into is biochemical examination. Yes, biochemical assessment. For biochemical, I will just briefly tell you that these are things that are done in the lab. You and I cannot do anything about it, but there are some aspects that people think they can do some exercises. How to know if you have a high sugar level? They usually say that You can just go and you pee somewhere, and if you see ants surrounding it, that tells you diabetes is coming or you already have it. Now, what happens to other things, other aspect? High blood pressure. How do we know that? That is where you can go for lab. So biochemical is talking about the lab, mostly lab stuff. You will have to know the red blood cells, hemoglobin, white blood cells, platelets, red blood cells count, all of those things. All of those things. And knowing them and also knowing how to interpret them as well. And then it's just like, yes, lab result. Yes, lab result and test presentation. When you take a lab result, you go to the doctor, and the doctor will interpret what is happening to you, and so you get on with the next um, aspect, which is treatment. So you also get to know things like your total cholesterol. Like I told you, there is bad cholesterol and is good cholesterol. So the bad cholesterol is known as the low density lipoprotein, and the good cholesterol is known as the high density lipoprotein. So you can check all of this in the hospital. They are quite costly, but you need to know them. And then we also have their interpretations too. And we also know our triglycerides too. Those are amino acid types of amino acids in our body. Nutrition management too, they are also involved. And this nutritional management for lipid profile, for high LDL,